CBC's medical contributor is Dr. Peter Lynn, and he's been very much helping us understand this story from the health and medical perspective. Here with me again this morning. Number one, we should tell you that the breaking news that a boy was seen transported on a stretcher and by ambulance, you think is a good sign.
Yeah, that's a very good sign, because one of the boys or one person was transported by helicopter the other day, and so therefore that would mean that that person was sicker. Whereas
more urgent to get to hospital.
Whereas the other three could go by ambulance and take that sort of 50-kilometer ride. And so the fact that this fifth boy, it sounds like it went by ambulance, that's a good sign that they didn't need to urgently airlift this child.
Okay. We know the 4 that are in hospital. We don't have exact details on their health, but they're saying stable condition today. But they are undergoing a battery of tests. They are having tests of blood. They are having tests of urine. What would they be looking for there?
They're basically looking at the internal organs. Are the kidneys functioning? Because when they were dehydrated, the kidneys would not have had a lot of blood flow. So therefore, the kidneys would begin to shut down. And so they're looking to see if the kidneys are functioning. They're looking to see if the liver is functioning. They're looking for, is the heart. So they'll be hooked up to ECG monitors to make sure their heart doesn't suddenly stop, because when the heart runs out of nutrients, it could stop as well. So that's what they're monitoring for as well. They're taking also precautions in terms of all the different things that they might be exposed to, and so that's why they're keeping them under wraps, so to speak, if you want to use that term.
Well, when you look at all the things that they have been potentially exposed to, in that cave, the water they were drinking was from the stalactites, was it not? I'm thinking of human waste and who knows what else from animals or pests or whatever in those caves, right?
Yeah, one of the things is the cave disease, which is from bats. So basically bats have droppings in there, and they may have a fungus, what's called histoplasmosis, and that gets into the lungs, and that can cause a lung infection, and it can wander within the body. So they're checking for that as well. The good news is that because of the flooding, maybe they've washed all of that stuff away, and so therefore maybe they won't have those diseases. But those are the kind of diseases they're looking for.
So when they say, as they did this morning, that the boys, their lungs are being x-rayed, it's for that histoplasmosis that you're referring to.
Just to make sure that they didn't breathe in anything, make sure that their lungs are functioning. So effectively, they're trying to check all the organs, because remember, during starvation, you start to break down everything. So they used up all their sugar stores in their body. They used up their fat, which they didn't have a whole lot of. Then they started to break down protein. And so when you break down protein, everything is made of protein.
In your muscle.
Yeah, your muscle, your heart, all the cells begin to break down protein. It's sort of like burning all the books to stay warm, sort of speak. And so what happens is that they were burning all this protein, and so therefore we don't know which organs are functioning or not, and that's why they're so careful with them as they're helping them recover.
Because they had no food for such a long time, or limited food, into that malnutrition concern, doctors are worried about something called refeeding syndrome. What is that, Dr.
Yeah,
Lynn?
so this we discovered after the World War II, you know, where we have severe starvation and then people got refed very quickly. And what happens is that your body tends to store everything, sort of fill the shelves. And as you're filling the shelves, it needs stuff like potassium, magnesium, phosphorus that's coming from your blood. And if, let's say, those ingredients, those electrolytes are low, then what happens when you extract them? Then there's none for the heart, and the heart needs that to regulate its beating and everything else. And so what they notice, if you refeed them too quickly, their heart actually stops. And so that's why they're going to be monitoring them in terms of their electrolytes, all the things that the heart needs to function, to make sure that they're replacing that as they're feeding them back. So even though they want, you know, fried chicken and all these other things,
they've been tweeting, they've been giving their messages, exactly. Take me to the,
Yeah, to have pad thai, this and that. So that's the one problem that they're facing. The second one is that they're missing some of the enzymes. So the digestive enzymes that your pancreas produce is protein. And so therefore, if they haven't been eating, they weren't making those enzymes. So therefore, they might not be able to digest. So what they're eating may be more like baby food, unfortunately, than real food.
Until that time. Just hold on for just one moment, Dr. Lynn. What we're looking at now on the screen here is exactly to corroborate your point. This is what local television is now posting. What is a scene from today, about 45 minutes ago, getting close to 50 now, of an ambulance leaving the cave site and transporting what we believe to be the 5th boy to hospital. And indeed, The Guardian, which has been doing really a fantastic job of following this minute by minute, a source confirming to The Guardian just moments ago that it was indeed a 5th boy who emerged from the cave. Local reports say, as I said, about an hour ago, about 50 minutes ago. So again, going to hospital, where we are understanding the boys will be under observation for 5 to 7 days. It's unclear whether they've been allowed to see their families yet, but even if they do have a chance to see their families, what we're being told, Dr. Lin, is no hugging, no touching. Why is that?
Yeah, it's because of fear of infection. So just pretend these kids have no food, they're starving, so their immune system is bad. So they would have sacrificed their immune system in order to survive. So therefore their defenses, there are no defenses. And they're worried that if everybody starts hugging them, then basically they bring them germs and viruses that their body really can't handle. You and I have a good immune system, we have lots of germs on our body, we can handle it. But for them, think of them like that child in the bubble that we used to talk about, where they're missing an immune system, and that's why they're taking these precautions, even though it sounds horrible. You know, the parents just want to hold their own child.
They've been up all night, not sleeping for days. So it's to avoid the risk of transmission to the child.
Correct.
I thought it might be the other way around. They might have been exposed to something in that cave that they also didn't want to transmit to their
parents. That one they'll probably know already, because the doctors will take precautions, so they'll be all gowned when they're checking them out, but definitely they'll have checked that out. And the other way is the worrisome thing, that we're going to bring them all sorts of germs all at the same time and then cause them to have infection. So imagine malnourished already, and then they have to deal with an infection like a pneumonia or something like that. They wouldn't be able to handle it. So that's why they're going to treat them like the bubble kids, I guess, if you will, until they are sure that they've refed and their immune system is back up to normal.
Okay. I want to move to psychological health for a moment or two. We were hearing from the schools the boys attend that they have psychiatrists there who are going to be working with the boys and help them to return to school and to their normal activities. What kind of mental effects could this have on a young boy?
Yeah, and I started looking at the Chilean minors, and they all had depression, post-traumatic stress disorder. Post-traumatic stress disorder is the most common one, because the brain tries to make a record of this horrible thing that's happened and see to make sure that it doesn't happen again. So therefore, they might, when they go into the dark, they may have panic attacks. If they go into a small room or an elevator, for example, they may have that as well. So that'll be the most important thing to watch out for and to treat, and to keep the kids together. And they said getting them back to normal life is the best thing for them right now. But it won't be normal in the beginning, because they'll be celebrities, hopefully, that they can move around. And that's what the minors said. In the first couple of months, they were celebrities, and then it disappeared. And then all of a sudden, the depression and anxiety kicked in, and that's what we have to worry about.
It was interesting, as we look at this picture of all of them together, some experts I was reading were saying because they've experienced this as a team, as friends, they may be able to deal with it better because it's a shared experience, not some trauma that one individual has gone through.
And also they know what each other's going through. So if all of a sudden they start to cry, they get it, right? Whereas if they're with other kids, they'll go, what's wrong with you? And they'll look abnormal. So therefore, keeping the team together might be the best thing for them, but getting them back to normal life as quickly as possible is one of the key features.
Dr. Lin, thank you very much.